Ideally, the doctor would introduce themselves with their name and their pronouns and, just roll with whatever the patient says
Sure.
that they want to be called and the pronouns that they want to use. And it's always possible that you could slip up and use the wrong pronoun or the wrong name. Best thing to do in that case is just apologize really quickly, correct yourself, and move on. It doesn't make it any better if you fall over yourself for 10 minutes and make it about yourself. Oh, it's so hard. That doesn't help. Just apologize, correct yourself, and move on. Beyond that, in terms of talking about, the behavior of providers themselves, one thing that I think it's important to understand too is that trans and gender nonconforming people understand that in a medical setting, there are situations where you're going to have to know what parts we have,
Sure.
right? So one
They all
thing,
need care.
right? One thing that's very important is if it's in an interaction where it's important to know what parts a person has. I think it's very important for a provider to say, okay, we need to talk about this. What would you prefer me to call your parts, right? So, like most things, just a little bit of care and a little bit of extra, conversation goes a long way. Because for the most part, the patient that you're talking to that is trans or gender nonconforming, they probably have been in this sort of situation before. And they've probably likely had really negative experiences before. So just taking that little extra time to ask, okay, what do you want to be called? What should I call these parts? That really helps quite a bit. Beyond that, too, I think it's really important for providers to understand that having a trans or gender nonconforming patient isn't your opportunity to satisfy your curiosity about that population. So if a trans person comes in with a cold, there's no reason for you to ask them anything related to being trans or their transition. The only reason you should ask any questions related to that is if it's something that's directly applicable to the treatment that that person needs.
Like a medication
Right.
interaction or something.
Right.
That's
Right.
directly germane.
Exactly.